guys, so if everybody starts coming into the roundtable here, we got a poll up that we'll leave open for our opening segment here. If you can go ahead and start filling it out. Just let us know what your top reason for attending today is. What's kind of the most burning question you have. We'll use the latter half or so of our roundtable today to kind of prioritize some Q&A and get some good discussion going. When we went to plan this thing earlier in the week, we found it really easy to get into the weeds on some specifics. So we're going to try and stay above that for the first session and touch on some higher level, big picture type stuff that are going to be applicable to everybody, regardless of the size, nature, scope of your program. And then we'll dig into some of the more pressing specific concerns that people might have later on in the roundtable. As you're coming in too, just remember that these are recorded and they'll be thrown up on the NIRSA Ideas in Motion website. They're getting those things up pretty quick, 24, 48 hours. I found that they have them up along with a chat transcript. Please use the chat to throw questions in, especially as we're going over some of the big picture stuff in our individual plans for our programs and in our departments at our unique institutions. If something pops up in your head, throw it in the chat, and we'll use that in addition to this poll that's running now to help guide some of the Q&A we do at the end. If you can, please throw your institution name into your chat so it can help remind us where you are and give us a little context to your question, as well as go ahead and mouse over and rename yourself in the participant list so that when you show up on the video, we can see your institution name. So I'm going to do that now. And that way, if you start to speak to the group or ask a question on the video, we see what institution you're from, what region of the country you're from, and that'll kind of help frame our conversation. Right, we've got 43 people on now. We had a little over 70 pre-register, so we'll take another 2 minutes or so and see if anybody else will join us late. And then we'll get started here. All right, we'll go ahead and introduce ourselves, and then we'll get moving into stuff. My name is Trey Knight. I'm the Assistant Director for Outdoor Adventures at the University of Miami. This will frame a lot of what I have to say today because it's a brand new program going in a brand new facility. So some of the things that I'm doing or don't have to do or deal with at this point are because of that situation. I'm also the Vice President of the Board of Directors for the American Canoe Association and the Chair of the Safety Education Instruction Council for the American Canoe Association.
My name is Joey Parent. I'm the Assistant Director for the Outdoor Adventure Program at Virginia Commonwealth University. Our program is a bit older. We've been around since about 1982 and a fairly large program, through 4 full-time staff, a couple of GAs, and about 50 student employees. And I am a member of the board of directors for AOR. And yeah, that's me.
Hey friends, my name is Josh Norris. I work with the Adventure Leadership Institute at Oregon State University, and we have, just a different program that sort of combines both academic and traditional outdoor rec programming. Excited to be here.
So thank you guys for joining us. Thanks to Joey and Josh for jumping on this idea. Kind of came up mid last week, reached out to them, and they were kind enough to put in some time this week to prepare what we're going to go through with you guys today. So the framework that we want to use to guide us today is that we're going to kind of, instead of diving into all the different aspects of outdoor programming that you may or may not have as part of your program, we're going to look at kind of how a recent article that came up that I saw from a professor up in Harvard and one of the big Boston universities, where he framed things as like, what can you do for physical distancing or social distancing? What type of PPE should you have or could you require? What type of screening are you doing, allowed to do? What type of scheduling and like shift work can you do that both limits kind of infection and outbreak mitigation, but also could help with contact tracing should you have an outbreak on your campus. And then something that's a little bit unique to us on college campuses is, what is that social compact or new social contract that your division or university or department is going to try and have students and faculty and staff abide by, as some of our restrictions might be mandated or might be just strongly urged, and helping the social side of that come into things. So those are some of the things that we looked at, and I'll run through some kind of examples of this. I got a little bit of a quick slide to help people frame this, and then what we're going to do is we'll put up a spreadsheet that we use to kind of put up our different approaches that we're taking to some aspects of our programs and the different phases of reopening that seem somewhat common. Your phases may be different than ours for your institution or your state, but we try to generalize that a little bit. And then after we get through that, we'll kind of open it up with our results and look at some Q&A. So a little bit of a lag here as I switch to this. So the first thing that we looked at was physical distancing. Things to think about is make sure you're following the CDC guidelines. They have guidelines for Parks and Recreation Administration. They have guidelines for institutions of higher education. They have guidelines for groups and events. They have guidelines for youth programming and schools, and things that we might do could interact with all of those guidelines. So kind of go through their different guidelines, figure out what might apply most to you, and then you can use that as an initial framework, and then look at what you might have at a state and local level or institutional level that's going to be on top of those more fundamental guidelines from the CDC. And that's kind of that, like, what can you do, what can't you do? Obviously need to make sure you're following your local and state health restrictions, guidelines, rules, new university policies that may or may not be coming out. And then on top of that, you start to break down, what does physical distancing look like for your facilities, and what type of approach is your university, department, or program going to take. So what can you accomplish? Think about how much it'll cost. If you're doing engineering, you're like putting up walls or moving walls or buying plexiglass shields to help with distancing, barriers and things like that. Spreading out your staff so that you can operate in a bigger space. Maybe you're spending more money on payroll. What resources do you need? Like what type of signs or messaging or markings are you putting on the ground? Can you get those? Where do you get those? How do you get those? What does it cost? What does the supply chain look like? So when you need to order more in 3 or 6 months, can you do those things? It's really kind of breaking down all the aspects that go into physical distancing, indoor versus outdoor, for your spaces that you operate with the kind of financial and human resources that you have. The next level we looked at was personal protective equipment. This is a big one. One, there's huge shortages worldwide of different types of personal protective equipment. So the first thing is what can you get? What can you continue to get? How much does it cost? What's your lead time? So when do you need to order more? Does it take you 6 months to get it? So how do you know what you need in 6 months, especially at this point? What is your state or local restrictions? I know for me in Miami-Dade, if we're inside and social distancing is not possible, it's a county rule that we have to have face mask on. Some places that might be recommended, strongly encouraged, not required. And then, what PPE is required for your staff based on state, local, federal guidelines. OSHA has a nice little pamphlet out that helps you categorize your staff into risk categories, and then recommended PPE for those different risk categories that might supplement your institutional requirements. Talking to your Office of Emergency Management, things of that nature can help you ensure that you're in line with what the university is doing. And then maybe if you have unique needs, you can take it a step further when maybe physical distancing isn't quite as possible. And you might want to ramp up your PPE requirements, and those things balance one another out. And then the impact of mask on heavy exercises. That's a hot topic in campus recreation and kind of sports medicine and things like that right now for different age groups, different health conditions where, you know, heavy exercise in a mask could be a pretty significant health risk to some people. So are you doing activities that might really get people's heart rate up and respiratory rate up, and what impact does the type of mask that you're asking or recommend them to wear have, and you know, making sure that you're talking with risk management at your university, your health center, medical staff, and advisors at your university to make sure that you don't put anybody at risk and are again in line with state and local and university guidelines. After that, we looked at screening. So what can you ask legally? What are you going to do with that information? How are you going to store that information? And you know, how does that potentially help any type of institution level epidemiologist or contact tracing that's going to happen? And then what type of testing do you have in your area, so that if someone, either a participant or more importantly a staff member, were to screen as positive for high potential of maybe being COVID-19 positive, you know, how long does it take to get a test and get those test results and can get them cleared to come back to work, and what type of pay are they entitled to in between, and those types of things. So, you know, getting in contact with health department, health services in and around your campus, and then human resources, and then, you know, division and department alignment. Something that we thought was really unique to think about is this idea of shift work. You know, CDC recommends kind of this A/B schedule, so that you're scheduling your student staff or your other staff teams in these cohorts where we're limiting exposure. So if we have to put people near one another and raise that risk level a little bit, we can make it easier on our contact tracing professionals should or when some type of outbreak happens on campus, that we can limit the number of people that our staff are interacting with, especially as far as we can control. The other thing to think about is maybe spreading out your hours. Instead of having 5 staff work for 3 hours, maybe you can be open for 8 hours, limit your capacity so that you don't overwork or put your staff at additional risk, and kind of spread those resources out over the course of the day and minimize the staff-to-staff contact without incurring any additional budget cost. And then lastly is just that social compact, to have the conversations with your department or divisional leadership, your dean of students office, your student code of conduct, and with human resources to see kind of what can you do if a student isn't following the guidelines, rules, or recommendations. What are the you know, options for you? What are the consequences, so that you don't threaten something that you can't follow through on, or so that we can educate the students that are working for us or coming into our programs about the true consequences and the serious nature of whatever steps the university or you're taking. So that's kind of the framework that we used to think through this, that we all kind of agreed was a solid way to think through things, and kind of helps you get from being too much into the weeds on any given topic. So we'll jump over, takes a little bit of a lag here, to Joey or Josh, you guys give me a thumbs up when you can see the spreadsheet. All right. So I got this zoomed out a little bit. I'll go over the guidelines, and I think, Joey, I think you were the first one in, so if you want to start. But we've got our phases here. Phase 1 is you know, closed, stay-at-home order, nobody in place. Phase 2, capacity limits of some type. Social distancing guidelines and protocols are, you know, required for most people. Pretty heavily additional disinfecting procedures for high touch points and things like that throughout facilities. Limited access to group-based fitness equipment or rental equipment of some type. So it's got to kind of be this bring your own type of situation. PPE put in place for staff, sneeze guards, you know, that physical plexiglass barrier that we're seeing in the department stores and grocery stores, things like that. And then, you know, the personal hygiene and respiratory hygiene levels. Phase 3 is kind of similar to that, but with some, you know, less things being required, more things being recommended, suggested. Maybe we're upping capacity from 25% of spaces to 50%. Maybe PPE is highly recommended instead of required. We're still recommending good respiratory hygiene, hand hygiene, additional hand sanitizer, soap and water stations, things like that. Still disinfecting, touch points really normal. And then phase 4, our green phase here, would be a resume to normal operations.
I think
All right, Joey, you want to take over? I'll see if I can drive here.
It might be important to realize that there might be more phases of this depending on where you're at and the area that you're working with. So this is just kind of generally what I've been seeing a lot of. It's kind of a 3-phase approach. However, you may find some other options for how people are opening their facilities and their programs. So yeah, looking at climbing wall reopening, I think Josh had some interesting additions to this when we were chatting earlier this week, that their climbing wall operation isn't going to be quite the same as it's been in the past, but they're trying to find ways to introduce hang boards and workouts and things for climbers in their facilities. So their climbing wall may not be open in phase 2, but they will have some options for climbers throughout their facility. And Josh, you might be able to chat a little bit more about that for those who are interested. But generally, most of us were looking at, climbing was fairly closed during that initial phase of opening, being that it's really hard to keep people away from one another when they're rock climbing. There's a lot of human contact. There's also just, close proximity when you're tying in, getting ready to belay, spotting one another. It's probably just not a good option at that time for most of us that have kind of been looking at this. For that second phase of opening, we're starting to see a little bit more options for clinics, small group interactions. I know some people are looking to potentially offer belaying by staff, and then people being able to come in, tie in individually, kind of be able to continue to keep that space from one another without actually being physically in contact with one another. Depending on comfort with people, bouldering may or may not be an option. Additionally, outside climbing is probably starting to kind of be available at this juncture, depending on transportation issues. But being able to maybe meet at a crag somewhere to be able to offer outdoor climbing clinics and things like that. Other things to consider is cleaning the wall. Climbing Wall Association has come out with some pretty good guidelines on how to clean climbing holes and walls during this time period. A lot of it comes down to a spray bleach essentially, and how often we're looking to clean the wall and the holes that are available there. So I would highly encourage folks to look at the Climbing Wall Association and some of their guidelines that they've come out with on how to reopen climbing facilities at this time. And then, moving into phase 4, starting to again reintroduce general open climbing for those that can come in and belay for one another and climb with one another.
For us, we have a small wall. It's a small bouldering wall and a fairly open facility. We've got a lot of good access points where we can have a single point of entry, single exit point of entry, some good floor space around the wall. So we're going to open up with, if we're on campus in the fall, when our facility is completed at the end of July, we'll open up with some bouldering based on the square footage requirements that we're using for our department. If you use 6 feet per person, kind of make a circle and round up, we're going to do 150 square foot per person. So all of our department facilities, our capacity is going to be based on, what's the real square footage, especially when you take into account desk and different things, equipment in the room, figure out how many people can fit based on that 150 square foot per person. And for our bouldering facility, it's 4 people. So it's a really small number. And because it's so small, we think it's manageable and allows us to allow some level of utilization of the facility. We're only going to put, 6 or 7 problems up, and they're going to be around 8 feet apart. They're going to be pretty vertical. And so we'll tape the mats and put ground markings. The university's already come out with branded ground markings that we'll have to direct traffic to, through, and around the facility, as well as some ropes and kind of stanchions and things like that. So that'll help us control the flow, so that the people that are coming in to climb will be small groups, so climbing partners will come in, people that live together are already exposing themselves to one another, so that if they want to have a climbing partner or have somebody to spot them, it's pretty low risk. And then we'll have some infection controls for our staff. Masks will probably be required for participants and staff, based on what we're seeing from our university on a preliminary basis, though no official plan has been put forward, but based on the county and university kind of rumors at this point, unless you're doing some pretty high cardio stuff, we're going to require mask indoors on top of physical distancing, and then the plexiglass shields, gloves for mask. And then cleaning stuff, we'll have entree pre-wall, so I've reached out to them about both the holds, mats, and the wall, and the different cleaning recommendations we're going to do for that. And because we're setting so little density on the wall, we're going to isolate our holds. So we'll do a soap and water and vinegar soak to disinfect, and then isolate for 72 hours. And then after that time frame, we're pretty confident that the viral load is pretty low, and then we'll pressure wash to remove any dirt, grime, chalk, skin, things like that. But the Climbing Wall Association recommendation is don't pressure wash until you disinfect it, so that you don't aerosolize or create additional droplets for your staff that have significant viral loads. And then the staff who are doing that will have some rain gear that'll act as PPE, face shields, face masks, gloves, etc. As we open up more, again, my preliminary understanding of our university plans is that we're kind of go from 0 to 50, and not what it might be a 3-phase approach, like 0 to 25 to 50. So the jumps that we're making as we go from not open to open will be a little bit more significant in some places. And then, phase 3 is just kind of continued operations, making adjustments on what we're seeing and any type of outbreak or changes we need to make based on local or university guidelines. And then reopening will probably be pretty conservative in a big major metro area with lots of tourism. Again, conversations with university leadership is we're going to try and keep the campus pretty isolated as much as we can. So we'll still have, until our leadership is confident about, herd immunity, vaccine, things like that, we'll probably have some type of mitigation efforts towards outbreaks for the foreseeable future.
Yeah, the only thing I have to add about all that, like Joey mentioned, was during what's being identified here as phase 2, while the climbing centers, both of them will be closed. And by the way, our capacity issue actually varies based upon our different climbing walls because of both their access and their total square footage difference of footprints. So we right now for summer, which we were supposed to open on Tuesday, but now we've been told not to, we are not going to be operating one of those. So I imagine we'll have some learning from one that will then translate when we go to open in late summer, both facilities. But like Joey had mentioned, we're going to be moving some of the functional fitness equipment outside and then using that with climbing staff and some hangboards to sort of continue to engage, similar to how we've been doing it for remote programming, where we have climbing staff doing, at-home workouts for climbers and so forth. So, yeah.
So you want to run us through some of your rental program steps?
So our rental program will be opening first. I think like a lot of programs are seeing, our rental operation is going to change quite a bit. We're not going to be open our normal capacity, so we'll be more renting for longer periods of time as opposed to like day rentals on a regular basis. So we're trying to break everything up into like Monday, Wednesday, Fridays with long weekend rentals. And then we're only at this point renting hard goods. So things like kayaks, mountain bikes. We're trying to stay away from soft goods like tents and sleeping bags for the initial opening, just that they're harder to keep to wash and keep clean and keep around. For us, if we rent 50 sleeping bags every single weekend, just being able to like turn those over for Monday to be able to rent them back out on Monday is just really not an option for us. So for right now, we're just going to kind of stick with hard goods that we can clean pretty easily. And then we're also going to be kind of redesigning, so to speak, our rental center so that we have a big bay door. We have a standalone facility, a big bay door, and we're trying to basically meet people at the bay door so they never even have to come inside. We'll have a counter there. They'll ask for equipment. We go back and pick it up for them, drop it off at the counter, and there's a screen that'll be in front of the students while they're checking gear out. So it'll change our rental center operations quite a bit, but we think it's a good way to handle it. Also keeps people outside as opposed to coming in. And then during phase 3 of the opening, we'll start to increase our number of days that we're open, the amount of time we're open, which hopefully should allow us to be able to start introducing some more of the soft goods that we can wash. A lot of the guidelines on washing soft goods has been soap and water works great. So if you can get your sleeping bags washed and run through the wash, that's a good way to kind of get the virus cleared off. With our tents, that's going to be kind of, we have yet to see how we want to deal with that, maybe an outdoor washing, but slowly trying to reintroduce some of the soft goods so that eventually we can have our full line of equipment available for rent.
We're doing kind of the same thing. We're going to have reservations. We'll allow for walk-ups, but all of our messaging and everything we can do to promote reservations so that we can get the equipment pulled and packaged and picked up with minimal contact, as well as shorter periods of contact between staff and participants. We're going to look at maybe having some bays. Our facility opens up onto a loading dock that's on a pretty big access lane. So we may have it, grocery store style where you pull up in a marked parking spot, call us and say you're here, and we take stuff out and have as much of the payment and paperwork side of things done online beforehand. And then we're only going to do Monday or weekend rentals. So we'll again, like Joey, we're going to stay away from soft goods initially. Going to see how the process works with it easier to clean and easier to disinfect and easier to isolate items. It's a lot easier to just stand kayaks and paddleboards up in a corner and kind of a quarantine section of our facility than it is to have 10 tents set up to air out and isolate that 72 or more hours that people are recommending for the viral load to come down. So we'll just do the weekend rentals, and then anything that arrives late potentially is pulled out of inventory for the following weekend, so that hopefully everything comes back in on Monday and we can clean it, and it'll sit Tuesday, Wednesday, Thursday untouched and isolated and tagged, and then we'll start it all over again on Friday. And then as we move into phase 3, we'll probably adjust that again, start looking at how efficient and effective can our cleaning processes be, how confident are we that we can get stuff through, clean it and or isolate it, tag it, not make any mistakes, and run something out that is potentially labeled dirty or contaminated. So as we roll all that stuff out and get better at it, we'll start doing some different rentals. Maybe we go Monday, Wednesday, Friday, allowing 2-day rentals or single-day rentals. And then phase 4 will open back up, but we'll still probably go as contactless as possible, just because it's more efficient for operations, and then continues to help us manage any long-term infection risk. Josh?
Sorry, it took me a while to get my mouse down there to the unmute button. Yeah, I would say additionally for us, because all those things map over pretty consistently, like Joey, we're moving operations to a roll-up door to keep participants mostly outside, if that makes sense. And then we also have a big bike shop, or a sizable bike shop adjacent to our operations. And in phase 2, we will be opening that again outside. We're moving at least 2 or 3 stands outside and sets of tools that will then be disinfected after each user and so forth. So we're stepping into that again, like everyone else talked about, requiring PPE for staff probably the whole time and so forth. Yeah.
Right. So, Nate, can you share our poll results? I'm going to see if I can turn my screen share off now. Right. So, climbing wall questions, budget concerns were two big ones. Dealing with local hurdles, barriers for the state, county, or city. They're all the same. So a quick plug, I just saw, we will post a link to this document in the chat, and I'll also post a link to the Google Sheet that's been going around that started out on an AOR board a couple weeks ago in response to some dialogue going on there on the message board to help with more collaboration. There's over 20 schools now that have posted into that Google Sheet information about their reopening plans. So we'll get both of those plugged in here so everybody has those, and that they'll live in the chat when the chat goes back onto the web here. Josh has also got a science package that he's going to share before we jump off here to help with some of that type of messaging concerns that people might have, because that's kind of high up on the list. So let's talk about local hurdles, barriers. Josh or Joey, do you guys have any experience, any challenges that you guys had that you have some insight for with your department, university, program, et cetera, dealing with local or state restrictions, guidelines, et cetera?
Yeah, go ahead, Joey.
Yeah, so we've recently had some issues. Hasn't impacted our program specifically, but the governor of the state was going to open up restaurants last week, and then 12 hours before everything was supposed to happen in the city of Richmond, our mayor actually pushed that back 2 more weeks. So we have our state level and our city level that are kind of in conflict with one another. So a lot of people were scrambling to deal with that, and I anticipate that being similar as we move forward, just being that we are smack dab in the middle of a pretty major urban city in Richmond, Virginia, and the impact here is a lot different than some of the counties that surround us. So just kind of looking at that, where we have yet to hear anything about recreation facilities opening up and what the regulations are going to look like with that. But having looked at how they've opened up salons, outdoor restaurants, parks and recreation facilities, I think that we're likely to see a lot of regulations that are going to come out of the governor's orders. So we're going to have to be pretty quick to scramble to meet those guidelines once they're initiated. One thing we've seen a lot here is that the guidelines have come out so quickly that people haven't been able to actually meet the standard because there hasn't been enough time between when things were announced and when the opening date begins. There's just not enough PPE around. People haven't figured out how to channel people into specific areas, keep 6-foot distances, things like that. So even though facilities might be allowed to open, they may not be opening for 2 or 3 weeks after they're allowed to.
Yeah, I would say we have some of that similarly occurring. We have an interesting state battle going on. The governor's office was able to coordinate with the Oregon Health Authority around a lot of those guidelines, including fitness centers and other things that we would find ourselves squarely within. The issue was then that there's been a fight at the state level about the legality of her executive orders and whether or not they've gone on indefinitely. And so as a result, we were supposed to open next Tuesday because they were letting the counties that campuses were in dictate what phase they were attached to. And then after a judge ruled against the governor in a county on the east side of the state, which for those of you that don't know, we have a pretty extreme rural-urban divide. In Oregon, we have large swaths of the state that are sparsely populated and very rural. And then we have some pretty densely populated comparatively other parts of the state like Portland and the Willamette Valley. And so there often is a political divide between those spaces. And so in this particular case, now the governor has said all state institutions will abide by the executive order, not by the county guidelines, even though they had approved county guidelines. Seems to be a little bit couched in that. Yeah, so we are now not opening. At least the current idea is now June 13th when we will be moving into what we've identified as phase 2 in these documents. So, and it, by the way, we did not find that out until Wednesday afternoon that we were not opening the following Tuesday. So, Trey, is it okay if I just share that sign package real quick?
Yeah, go ahead.
Would
No,
be
don't forget.
a good time. Okay. I just think it might help people to just sort of incept what they're thinking about for their facility. So you can see we have both equipment, some of these just general messaging stuff around where the lines are, general reminders in certain spaces, an idea of which parts of our facility are currently closed, and then identifying, again, our center identifying one side of the building as an entrance and one side of a building as an exit. And then you can see some of these. As we talked about before, where they would go to do certain things if they were separate or different than they were before. Yeah, a little bit again around some of this stuff around the Oregon Health Authority. And then you'd mentioned this at the beginning, Trey, this idea of this social obligations. You may have seen this at some establishments where they're saying, here are the things we're doing during this time. Here are the things we're asking of you. Okay, and that's it for that. I just felt like that might be helpful for people to be sort of brainstorming and thinking about what type of signage you would need within your operation.
Yeah, I would say reach out to either in your department, division, or university. I know we have our university communications and emergency management offices working together to create standardized signage for campus that encompasses everything that we need and things that we don't need just because of the nature of our spaces, but other offices might need that include pathway arrows for the ground. You know, like Josh was sharing, we've got please stand here or please wait here until called. Other stand here, you know, 6 feet apart reminders and all sorts of different kind of shapes and sizes and formats for, you know, and the university has got, if it's going to go in a classroom, it needs to be this big. You know, it's a 9-inch circle. If it's going to go in a big open area, it needs to be a 12-inch circle. If it's going to go on the ground, there's a different version to order that'll stick to the concrete better than it might to a wall or a piece of glass. And so that's all being managed by our Office of Emergency Management and Facility Services and Operations. So I just order it and they'll give it to me. I haven't, like, we've done that, but we don't know when we're going to get it. And if we need more, what that timeline looks like. We're kind of over ordering so that we don't have to reorder from them. And then the other thing is I don't have to pay for it either. So that's a good thing. Does anybody have anything else about kind of dealing with the local or state level things that where your university is at odds or your department is kind of trying to wade through that you know, you want to share with or would be helpful to the group before we move on to talk a little bit about budgeting?
I'll just add that there was a comment earlier about CDC regulations or recommendations being different than like local and state. I've seen typically for us that our university is making more conservative decisions than a state and local governments are. And a lot of that is being driven by CDC recommendations. So, you know, obviously that's going to vary from place to place, but I typically have seen us making decisions more based on the science end of things than the I want to open businesses immediately end of things. So just some things to consider there. I'm not saying one's right or wrong, but that's just kind of the way our university has tended to handle this.
And if you're getting pushback and you're looking for resources, that's where you can reach out to your peers in your state or your region. A lot of how things are shaking out are state oriented. Obviously localities are different. You know, Florida, like Oregon, we've got some very rural areas and some, you know, some extremely large metro areas that have high community transmission rates, Miami being one of those. The other thing is to look at different associations and organizations, and maybe their recommendations can give you some validity or clout. So, the NRPA, the National Parks and Recreation Association, has a pretty good comprehensive list of things that might be very facility or outdoor space related. So if you're looking where you might manage some unique outdoor spaces on your campus, and you're not making headway, or you need some backup, that's a very large respected organization with a lot of research going into those recommendations. Youth programming, the American Camp Association. You start looking at more specific stuff, American Canoe Association, PCIA, AMGA, the Wilderness Education Collaborative. There's a number of these associations that kind of have their niche and specialty, and us being kind of jack of all trades people, you can look out and find those resources and reach out to your peers to help you with that. I found that helpful as I've worked with my leadership to share some of that, and they found it helpful in saying, oh wow, that's an interesting point. If you haven't looked on the Climbing Wall Association, their roadmap to reopening, the way that they present and formulate that message, I think is really concise and really effective. And I know I shared that with some of our leaders in our department. It's just like, hey, I know we're going to have to share this. I also shared it with my role in the ACA. Like, this is a really nice way to format and segment our recommendations to make it really easy on the consumer to digest. So it might not be the specifics within it, but it might just be the messaging that you can take and use. So if nobody has anything else, we'll jump on to some budgeting stuff. Again, we're probably all in similar and also very different situations here. So, take what we're doing with a grain of salt. But I'll start real quick because my comments are pretty quick. Certain of our budget lines are somewhat unchanged, which was surprising when I had a meeting the other day with our budget director. My program is really unique in that I'm actually funded through housing and residence life and not wellness and recreation. So my budget is a little more tied to the university occupation or the dorms occupancy rates and the revenues from that than they are the student fees related to recreation or membership for non-student members. So a little bit of a unique situation, but our university mandated some pretty significant cuts on some lines, around 75% for travel, entertainment, promotional items, things like that are kind of icing on the cake from an operational standpoint. No travel. So if you submit something and you're going to go to a conference and put a presentation on, like, you're going to do that on your own dime. They're not paying for memberships or anything like that. So a lot of the things that are nice but aren't crucial were cut pretty significantly, and some other areas were marginal 10 or 20% reductions in things like equipment. The one line that we've been lucky to keep is our student wage line. I think a lot of universities, if they are going to fully fund something, giving that money back to the students that depend on it to come and financially be able to survive on campus is something that they often have some hesitancy to cut. So that I was pleasantly surprised was pretty much untouched. So we're in a pretty good shape, except for we're not going to be able to do as much promoting and marketing as we might. I won't be traveling to any conferences or for certification renewals or anything like that. We'll be on my own, but all in all, pretty happy with where we're at. Some people will be better and some people will be worse for sure. Revenues, I'm not expecting any revenues. I think I cut my revenue projections by 70%. If we're better than that, great. But rentals and programming from challenge related programming, experiential education that we're going to do in the community or on campus, the virtual versions that we'll likely do for a while are going to be very limited. It's going to be hard to make a lot of money off of them. Really just kind of looking to cover some cost here and there. And then equipment rentals, we know, we're going to restrict the throughput greatly. So that's going to put a pretty significant damper on how much money we can generate there.
For us, things are still pretty up in the air. We don't have a really clear picture on what our budget's going to look like for coming year, and that we don't know how many students are returning to campus in the fall. I think a lot of that's going to depend on if we're open for students to come onto campus and what that looks like, and how many students are allowed on campus. So a lot of the things that we haven't really heard much about yet is going to have a big impact on what our student activity fees look like, which in turn is going to obviously impact the budget for the outdoor program. As far as currently, we're kind of, all of our facilities are closed. We're saving a ton of money in student hourly over the summer, money we projected to spend but are not. And then when we do open up initially, I think we're going to primarily be staffed by professional staff in the rental center. So we'll continue to save some student hourly there because, our trips program is not going to be running. So we'll be pulling full-time staff from the trip side of things to help out the outdoor center when we're open there. And in hopes that we can save some money this summer and be a little bit more normal in the fall and spring semesters so that, we can transfer that money then to students later in the year when they're back on campus, we hope. Similarly, we're anticipating less than ideal revenue projections or challenge course. We typically have a really large 1,000-person program at the challenge course every August for orientation. That's been canceled, so that's a pretty big line item there. And then a lot of people have been hesitant to book anything with us, the challenge course or for trips and custom programs because they don't know what's happening. So we're anticipating a pretty big shortfall there. We do have a split revenue model with our academic department that we partner with. So we are going to be able to continue to bring that revenue into to the program. And then fortunately, our team building and our our trips program are self-funded. So while we may not bring in as much revenue, we're also not going to be spending the money there either. So that's kind of a cost neutral area. Typically our trips are kind of, we cover our costs with what we charge for it aside from our full-time staff salaries. So even though we may not make a lot of money in those areas, we're not anticipating like losing any money there, which is a good place for us to be, especially when they are looking to cut programs. There's really nothing to cut there because if we don't offer it, then the money just is not there to begin with. So I think as far as being in a good place to continue offering those things will be good in this coming year. And again, our rental program should start to climb a little bit here once we open back up.
Yeah, the last thing that that I would add to all that is our funding comes from those three different areas, like student fees, academic stuff, and then revenue-based programming, which includes everything from challenge course to custom programs to just general clinics. And so 2 weeks into this, the head of our student fees committee, that student got together with a group of other students, and they went straight to the provost and asked for their money back for spring term. And the provost met with them and started negotiating without even talking to anyone within those student fee funded areas. And so immediately right off the bat, they took 15% of our spring term fees, which frankly, between that and decreased revenue meant as a department within the rec sports area, we're already having to cut FTE just to get to September. And so once September happens, we then have a whole new level of stuff to understand, especially because there has been precedent of refunding student fees when there is remote programming. And so now we're in that place trying to negotiate what does that look like and what does that mean? And a lot of those cuts, I mean, I think as a department, I think we're roughly around $700,000 is what we need to reconcile before we get to September. So yeah, we're not spending a ton of stuff. Obviously, we have been as a part of the negotiation to keep 85% of our fee. Part of that negotiation was to keep students employed, and I think in May, I think we were paying out roughly around 50% of the student employment dollars we were normally spending. So assigning, it's just under that. So assigning out either professional development being paid for by them or them doing remote work or remote programming. And so, so it's put us a little bit in a squeezed area. Like Joey had talked about, we have a lot of challenge course programming that's, that place is entirely revenue funded. And then we have all of our new student programming, which happens all summer long in the form of targeted custom groups that go rafting. And so, yeah, so all that stuff is kind of gone and off the table, and there will be another reckoning come September, depending on what happens with classes. And so I too share the concern and anxiety associated with budgetary concerns. So, yeah. Yeah, okay. And then I would just say one last thing about academic programs. We're still in the middle of figuring that out, like what that looks like. We've been doing some of our wilderness medicine programs. We've been working with the various certification provider, the certification provider that most of our instructors are with. And there's a little bit of negotiation going on, and we are in fact moving some of that to remote instruction. There still has to be some version of a checkout, and various institutions, if you look across the US, a bunch of places pivoted by just simply changing the title of their courses. So saying the theory of whitewater rescue for spring term, and then letting go of this sort of the closing piece of that. And so we're hoping to hold on to the closing piece of that. So for example, you could take wilderness first aid or wilderness first responder as an academic class, but not receive a certification until you complete your in-person checkout. And there's a few classes like that we've been working on. We actually attended a webinar from volcanologist. Apparently, in the field of volcanology, it's hard to take students to field trips to certain volcanoes because they're volatile field sites. And they know it to be an important part of the academic process for some of those people in that field of study. And so they have really spent a lot of time trying to develop what does virtual field trips look like. And so we're trying to expand our mind by attending those things and thinking about how they apply to our stuff. And I would say we're definitely not yet settled, but that's the stuff we're working on. Yeah. Okay. What do you think, Trey? Where to go?
Another thing people wanted to hear about was climbing. So I don't know if we wanted to talk in any more specifics than we did about, earlier our climbing stuff. One thing I had on my notes to comment on that I didn't was we're going to be doing reservations. If you've been on any of the CWA chats over the past few weeks, a lot of the gyms that we're looking to open or have already reopened, we're going to institute a limited audience. So, existing members or existing clients only, not opening to punch cards or walk-ins. So, for us, limiting guest passes and things like that. Or maybe, I know for me, I'm going to limit access to faculty and staff. So it's just student only, but that also goes back to how I'm funded through housing rates. And I'm not tied to the membership fees to the recreation center that the faculty and staff pay. So I can get away with that a little bit more. And that's going to limit our audience a little bit and give us some more control. And then we're going to do 60-minute windows where people will register through Fusion, like a court reservation. And then, we'll allow walk-ups as we can, and we'll have some signage on the ground outside to deal with walk-ups and things like that. And then we're going to kick everybody out every hour from the bouldering area and reset. So if there's capacity, you can come back in and keep climbing. But that way we can reset and be equitable to the people that are jumping through our reservation process and not having to worry about like, oh, when did you come in and what session you registered for? Everybody's going to go out and then swipe back in, and we'll measure our swipes back against our registrations to figure out kind of from a participation and assessment standpoint what the repeat client is versus the new client, and how many people who make reservations are showing up and what type of penalty. I know Texas A&M opened this week, and they were talking about they're doing reservations for their fitness, strength and conditioning area. And they have a penalty system that if you make a reservation, they're using IM leagues. If you make a reservation and don't show up, you get kind of banned from that reservation process or system for a day. And then, if you do 2 no-shows, it's a week, and so on and so forth. And then that's like a 50-person capacity for a 30,000 square foot facility. So, it's stuff like that is happening. So it'd be interesting to reach out to people that are opening their full rec centers or programs earlier than you, and kind of see what they're doing, what's working, and what sounded like a great idea on paper. And a lot of people are going to try because we talked about it over our roundtable, that in practice just wasn't as good, or maybe was actually better. Anything else from you guys about climb walls? I know there was some questions about dealing with ropes and soft goods. AOR had a chat that was out that had somebody from Petzl Lawn talking about some of their soft goods stuff. So I don't deal with that, so I haven't really kept up with stuff from the rope harness, cleaning process. But I don't know if you guys have any insight you want to share.
Yeah, I think I made a comment on there. A lot of the stuff is not so much about trying to disinfect your climbing wall and make it a sterile environment for people to climb in. It's making people aware that they are going into an environment that is contaminated and making sure that they are aware of the risks they're taking on and how to prevent getting sick in that environment. So, you're never going to be able to disinfect a climbing wall between every single use. People are touching it every single time they climb on that wall. So making sure that people are wearing masks and, people are looking to put hand washing stations in their climbing facilities so that they can wash between climbs, making sure that they are aware of all the things that could be contaminated so that when they come in contact with that, they're aware of those things. So again, one of the reasons I think a lot of facilities are opening walls later is that is because of that. Initially it's a high probability that there will be infection in the climbing area.
Yeah, and I was going to add to that. Yeah, I think you're right. Contamination is exactly the way to look at it. The materials themselves are just not able to be disinfected due to the nature of them. They're just way too porous. And but that being said, we were talking earlier today, Trey and I, the CDC sort of low-key changed some of their recommendations last week around how they think transmission is occurring, and they think it's very low probability for indirect transmission. I think it's pretty high probability of person-to-person transmission. And so what that means is proximity seems to be it, and there seems to be a pretty, that 6 foot thing seems to be expanded greatly when someone's vigorously exercising and or singing or yelling. And so, so if you think about it, that's kind of us in the climbing center. And so I think PPE becomes more important than, and I would just add the hand washing station is probably something we should have all done 10 years ago. If you've been hanging out in a climbing wall, hands are gross. And everybody's trying to wash their hands, the water fountain, and whatever else has happened in various facilities over time. So I see that as an opportunity. I know I was talking to someone at Montana State yesterday, and they have added sinks, double sinks at their climbing wall as a part of their new construction project in response to this. So, and I wonder if we should move to questions. What do you think, Trey? Just to make sure we have time for people to answer. And
yeah, those were the 3 big points people that jumped out on our poll was budget, local guidelines, and climbing. So hit us up with questions, or if anybody's got comments, things that you want to share that have come up in your mind, please.
Yeah. The comment about moving to bouldering from Courtney. Yeah, we actually did that in the ramp up, so to speak, before the full shutdown. We had actually moved to bouldering only for that purpose, because one, at that time we weren't sure about disinfection. Trying to disinfect those things and keep people away from one another was just easier to mitigate from a bouldering perspective. So we have certainly talked about that being part of the reentry process as well. So time to put your questions in the chat or unmute yourself.
While we're waiting on that, I think something else to consider is getting people outside and doing activities that they can transport themselves to. Things like, bike rides, even some outdoor climbing. The transmission rate is a lot less in outdoor areas. So there's just more fresh air moving around. It's not in a stagnant area. So if there is a way, we're pretty fortunate in Richmond that we have an entire park system that's half a mile from campus, so we can go mountain biking and road riding and rock climbing and kayaking and rafting and all these things that are right off campus. So if there are ways to be able to get people outside and doing things, it's in a park or on a river or whatever, they're individual activities. I think that's going to be a much better option for introducing some programming and getting people into outdoor activities early on. It's probably going to be a lot safer than being confined in indoor spaces.
Yeah, there's been a couple of research articles and papers come out as April and all the way through May that's shown the studies in Europe and China, and now we're starting to see some preliminary data from the U.S. The transmission rate outside person to person, which is, again, like Josh said, the main methodology for that is way lower. Orders of magnitude lower outside as inside, and it's tied to time. So if you're looking for ways where you're restricted to be inside and you want to mitigate things, limit the amount of people density-wise and also time-wise. The longer you spend in a restaurant or a space, the more likely you're going to get those respiratory droplets in your respiratory system. So if you can cycle people through in shorter time frames and get them back outside for a little bit and get some new people in, that's going to kind of limit some of your transmission vectors. I know we're pushing up a green exercise program that we were going to wait and launch in year 2 of our program, that we've now pushed our trip programs to year 2 and are going to do a lot of kind of like what Joey's saying is, promoting and helping people find structure and ways to get outside. We're going to put a lot more effort into our rentals, kind of like trips in a box, instead of helping people very loosely discover where to go and how to camp. As a new program on a campus, we're going to do all the work for them. And just have packages and things on our website that will promote, here's how you go there, here's how you get there, here's the package you need to rent. Hey, I want the so-and-so state park 2-day package, and we'll just here's the stuff, here's the trails you should hike or bike or whatnot, to really try and help kids get outside, stay active, get into green spaces, because there's significant research that shows that that's good for their mental health and overall well-being. So that's where we're going to focus, rather than some of the learning that we normally do. It's harder to do in without physical contact. We're going to focus on getting people active and getting people outside and helping them stay healthy mentally and physically. Guys, do you have any closing comments or any closing questions out there? We're at our 1 o'clock mark. Again, thanks to everybody for the time. And if you guys want to close us out with your final comments, and again, thanks everybody for joining us today.
Yeah, I was just going to remind us all, hang in there. Like, this is what we do. Like, not only as humans, but specifically as adventurers. I can think of no more noble cause for us to pursue adventure than to have the adaptive capacity for adversity. And this is that time. And the rest of our communities are counting on us to lead them through this in that way and to be there, right? And so I think there's a lot of bad news out there, and we need to be helping people find other stuff as well. And we're probably all experiencing some of that, right? Like a chance to connect with family, a chance to be sometimes in the sunshine, but at the same time, not abandoning the rest of what's going on. And so thanks for being the kind of people that care enough to show up to a webinar to try and get ready for that. So thanks for that. Thanks for being that kind of, those kind of colleagues.
Yeah, I just would say thank you, and try to keep communicating about this stuff. It's all super fluid right now, and a lot of the things that we're talking about right at this very instant are going to look way different in a month from now or 6 months from now, or things are going to come up that we don't even know are coming. So Josh is right. I think my entire career has been built around adapting, improvising, and overcoming stuff. And this is just a way to put that into practice in a different way. So keep communicating with one another, keep talking about what's going well, what's not. This is a big network of people that we can work with. So thanks.
Thank you, guys. Some of our presentation resources are in the chat. You can reach out to us as well, and we'll be happy to share anything we talked about today with you guys. You guys have a great afternoon and have a great weekend. Hopefully everybody gets outside some.
Goodbye, friends.